It's funny, you think about positive psychology and it sounds like it exists in opposition to negative psychology, which is totally not a thing.
Yeah. I mean, it's just a style of therapy that's all about focusing on the happy parts of your life, the good memories in your life. And there's no such thing as negative psychology, but when you do get in front of a therapist, like you tend to talk about the worst parts of your life.
Okay, can I try something out on you?
Yeah.
So basically, here's how I always kind of organized it in my head, which is that most people go to a psychologist to solve a specific problem. And actually, positive psychology is at its best when actually you don't have any specific problem. You just want to get better at being happy, at managing your life. It's about getting you from normal to optimal, rather than fixing your problem that you happen to be having at that specific moment.
That's very true, but it's not like anyone has no problems.
I'm Christopher Shulgin. I'm executive producer of Eat Move Think.
I'm Jasmine Ratch. I'm managing producer of Eat Move Think. The positive psychology part of it helps you handle your problems better.
Okay.
It gives you a different way to think about them.
Can it also be preventive? Like,
Yeah.
I think about preventive health. It's like, that's the stuff that you're doing to stay well.
Yes, our expert on the show today does give some great tips that you can just start to adapt to on a daily basis that will maybe help you think in a more positive way, think about your life in a more positive way.
So this is super appropriate for this podcast, I think, because we're produced out of Medcan. And Medcan is all about preventive health and optimal health. So I view that as kind of a tool that people use to achieve optimal wellness. And so I think we're talking about the think portion of that whole mandate.
Yes, and it's actually a really interesting conversation where we have two psychologists get into positive psychology. So they'll probably sound a lot smarter than we do right now.
Who are these two psychologists?
Today's episode features a conversation between Dr. Tayyab Rashid. He's a licensed clinical and a school psychologist. He works at the Health and Wellness Center at the Scarborough campus of the University of Toronto, and he's a faculty associate with the Human Flourishing Program at Harvard. I love that name of the program.
The Human Flourishing Program.
Yeah. And so he's been doing his positive psychology practice for over 15 years. He's in conversation with Medcan's clinical director of psychology, Dr. Jack Muskat, who's been on the show a couple times. He's a fabulous guest
We
host.
love Jack.
Yes. And so he gives an interesting lens. He asks the questions we're all wondering, like, what's the real difference? Is there a negative psychology? As a therapist and a psychologist, he gives that other side of it, like asking the questions that the therapist should be asking about positive psychology.
So it's a psychologist interviewing a psychologist about positive psychology.
About psychology.
Okay.
I'm psyched.
Let's get to the conversation between Dr. Jack Muskat and Dr. Tayyab Rashid.
It's Dr. Muskat here. Hi, Dr. Rashid. How are you?
Hello. I am doing well, given everything we have gone through.
That's great. And Tayyab and I go way back. We actually met through my wife, who's also a psychologist and who, I think when you came to Canada, hired you to work with the Toronto District School Board, which I was a part at the time. And we got to know each other quite well. And the work that you did has become very influential in the educational field as well as in the clinical field. So I'm just delighted to have you here today to talk to us about positive psychology, which I think, as you will know, is an oft misunderstood term which evokes all kinds of confusing and sometimes mixed messages around that. So let's start with, what is positive psychology?
Thank you, Dr. Muskat, for this opportunity. Positive psychology, if you look at the textbook version of it, it is setting conditions right and ripe for individuals, communities, and institutions to flourish. Now, that's a tall order in this relatively brief definition. But if you think about it, it is one of the most fundamental goal of our existence is not to decelerate. We are inbuilt, Jack, to progress. So what positive psychology by definition is saying, how can we systematically foster that growth. And it ushered on the horizon around the turn of the millennium, around 2000. And in 2 decades, it has amassed fairly substantial, rigorous evidence in domains like what we call positive education, positive health, positive workspaces, and positive clinical psychology. The word positive evokes a number of images and reactions. I'm not immune to that. By positive, I do not mean the rest of psychology is negative. Absolutely not. Psychology has a long, storied history of human existence and understanding it, from Aristotle to Socrates to as late Freud and humanistic. So all of this in my view, is a progression. What positive psychology probably brought more focus into sharp focus is taking the main tenets of humanistic psychology and reminding us that how can we put those notions of self-fulfillment, self-actualization under the microscope of science, and how can we replicate and how can we systematically enhance. That approach I brought into psychotherapy. It is called a positive psychotherapy. It's kind of a sexier term. If you would ask me if I would sort of invent positive psychotherapy, I would probably call it balanced psychotherapy. Of course, that will be bland and boring. But by positive psychology, again, let me reemphasize to our listeners, it is not about dismissing, minimizing, or overlooking negatives. It is integration of it. It is integration of when people have, let's say, grudges. We all have grudges, but we also have the capacity to be grateful. We have conflicts. Life is complex. In its complexity, we go in the ebb and flow of life. So along with conflicts, we also have the ability to cooperate. And one illustration is this: we're cooperating in a way to deliver this podcast. Likewise, human beings have the tendency to hate and to experience or display hubris. But human beings also have the tremendous capacity to be humble. So what positive psychology is saying that for a number of years and decades, we sort of missed, or we assumed if we would take care of symptoms, the well-being, the happiness, however you want to call it, will automatically spring. That is not the case. Absence of symptoms is not the presence of well-being. Positive psychotherapy systematically builds well-being to encounter the stressors that we experience in clinical situations.
Right. So let me ask you, from one clinician to another, and what we've seen in the pandemic, the absolute mental health crisis, not just amongst young people, but stress, anxiety, depression, languishing, hopelessness, relationships in trouble. The list goes on. Patients are presenting with all these symptoms. And I agree with you that, cognitive behavioral therapy or any approach to therapy, you cannot effect change without recruiting the positive aspects, meaning the strength-based aspects of an individual. But at the same time, when people are seeking help, they don't want to hear about positive psychology. They're not coming in with that. So the question in terms of your positive psychotherapy is, how do you assess initially the capacity of the individual to look at that strength-based or resilience-based part of them when they're in such bad shape?
Excellent question. And I would not expect anything less from you, Jack. It's an excellent question. And it's a question that I love to answer. I don't know if I have the very, very good answers for that, but I am searching for the answers. And let me try this. First of all, when our clients, they approach for our services, the fundamental aspect is to validate, to listen to them. Because if we made any faux pas in ruptures of empathy, we're going to lose them. And our window of opportunity to connect with clients and for their ability to come back is narrow. Nearly 30% of our clients in our clinic just come for one session. So most important thing is if they are in distress, listen to this narrative of distress so that you can build that bond. Second part is if you are a brilliant therapist and you have all the tricks and tools and strategies and skills, do you really believe in your heart your client would be ushered onto a road of fulfillment and they will have foster a healthy, positive relationship? They will somehow wake up on them one good morning and say, I have found the meaning of and purpose of my life? No. The clients come with a loaded negativity bias. They already see themselves either in an exaggerated manner that they are either less compared to others, or they are sometimes too much compared to others. So the timing to bring up those issues such as fulfillment, their strengths, their assets, their abilities are hidden, Dr. Muskat, within their narrative. And let me finish this answer with the help of a very brief vignette. I was working with a client and a very toxic, very disturbing relationship with their father. They could remember nothing because father had left. This person was primarily raised by a single mom. Somewhere along in the middle of our sessions, I asked, is there anything that you can possibly remember relatively positive? Relatively. So I've qualified it. They said, my father had lots of drug issues, alcoholic, but around holidays, they will always come back and they will take me to this mall. I vividly remember sitting on a carousel and moving around, and my father standing on the side and clapping for me. We had a poignant silent Jack. And the client teared up. And I think he got it. That for me to see my father in a completely negative light is not actually serving them. So remembering some good aspect of their life or loved ones while they are sharing their narrative, there's no fixed timing, but there are opportunities. And if you just keep your mind, ears, and eyes open to look when you want to ask this question.
And I would ask, how does positive psychology or positive psychotherapy fall into a separate tranche from regular therapy? Don't all therapists do this? Don't we ask our patients when they're coming to see us what they're suffering, do you ever remember a good time? But if we look at psychological well-being as a continuum, and the Eat, Move, Think podcasts at Medcan are part of our wellness, if you will, where we're trying to improve our performance, not just survive, we're still starting on the other side from a negative symptomatology where people are actually suffering. And I will ask them this question when they tell me their narrative and when they were successful in school and they were on the gymnastics team when they played sports, or they had adversities of dysfunctional families. I'll say, where is that kid? What happened to that person? Can we recruit that person? To your point, can you remember a good moment? What are we doing to ourselves that we can only remember the negativity we're in the moment? I think your approach is ideal for these situations. So can you help us unpack how we would even begin to do that, getting our fingers unclenched from that bar that we're holding on to and we're afraid to let go of?
If I may use this cliched term, usher into the new post-COVID world, if there is ever, my first sort of suggestion would be that we are inbuilt to respond to crisis. There's lots of research about post-traumatic stress and its impact. And of course, taking nothing away from it, there's another field which we have overlooked, and that is post-traumatic growth. So that framework could help us a lot. And there are a couple of things that I will share with you. If you look at literature, 7 out of 10 people who experience trauma also grow from it. That does not mean, let me qualify carefully and very cautiously, that doesn't mean their symptomatic stress of the PTSD related symptom is gone. Because we are complex human beings. We have both yin and yang within our own vessel of our existence. So I think we need to understand that we are not only built in to receive the stresses, we have an inbuilt capacity to respond. And despite all of the challenges, it is important to do what I call a cognitive appraisal or appraisal of stressors. all the stresses that we have experienced from public restrictions, masking, I think for me, the biggest one is COVID was devastatingly hard for humanity. When we were in trouble, we couldn't touch our loved ones. Think about it, people who died without seeing their loved ones or with minimal contact. So it is important to acknowledge the losses, but at the same time, it's also important to appraise the losses as well as gains.
Right. And I think what we saw is, interestingly, and on one of our previous podcasts early on in the pandemic, we were fortunate enough to interview Dr. Stephen Taylor, who's a professor at UBC, who wrote a book on the pandemic, and it's about the COVID stress syndrome. And he said that up to 20% of people use this opportunity to reset their lives, to rethink what they're doing, to spend more time with their families, to look at their jobs, to look at how they're living. And to your point, it became a growth opportunity to see something as simple as my visa bill is down. What have I been spending my money on? I don't miss those things. What are the things that are important to me? And the other thing that you'd mentioned, which is so important, is that we're now seeing in this kind of global natural experiment of social isolation, the actual harm, as we are social animals, and that we do need to reach out to one another. So the question is, why do some of us take adversity? You have lemons and you make lemonade, are able to take that adversity. What are the characteristics? And maybe we can then talk about the character strengths and the attributes, if you will, of how we recruit those. Why are they more accessible to some rather than others? What's the difference between personality and character? Is it situational? Is it dispositional? How does it differ from our character strengths? And know how to ask the right questions for help so that we can recruit them better. So there it is. It's all on the table, and you can pick any one or all of them and help us understand better how we should proceed.
I think it's a very important question. And if I could summarize it, is how, given all the negatives, and we have varying degrees of negativity bias, what are the key characteristics for us to grab on, to latch on to positives? And by the way, I was driving somewhere, I had the pleasure of listening to Dr. Taylor. He was on CBC. You were exactly right. His book is very insightful. So one of the things actually consistent with his approach, he also mentions the role of optimism. And that's where I will start. If anyone who is listening is thinking, you know what, the life was so hard on me, so cruel on me because I had this genetic accident. My mother was depressed. My father was alcoholic. And we had this flagrant history of family psychopathology. I am consigned to a life of misery. Well, the good news is that the mental health characteristics and personality characteristics, I won't say they are completely changeable, but as Marty, my supervisor, Marty Seligman would say, there's a certain genetic range. Because as research has robustly shown, your capacity to be hopeful and to be optimistic can be learned. Hence, that's why I'm not marketing for my mentor's book, but his book is phenomenal, Learned Optimism, in which Marty talks about if you can tune into the dialogue, how you explain the causes of negative events to yourself. Are they permanent or temporary? Are they personal, or they are more in transaction between you and the environment? And are they pervasive, or other domains of your life are intact? So this, I would say that optimism is one example. Through treatment like hope therapy, through mindfulness, we know that anxiety can be dealt with. So those symptom pictures tap onto our personality, and those personality by mindful focus, by focused sustained treatment can be changed. And what positive psychology, Dr. Muskat is making an argument, if those things can be changed, if we can scientifically demonstrate that symptoms can be reduced, well-being factors can also be amplified. That is where my hope in working with clients is.
So the things that most people do during any crisis is catastrophic thinking, denial, and rationalization. And so they're stuck because they think the worst is going to happen, and then they're rationalizing why they can't change. So they're in a rut. But the optimism is what's going to get them out of the rut. But more importantly, you're saying that it can be learned. I like the idea that we are not simply static individuals. Even the introvert needs to get out. I do want to say that in the early days of the pandemic, I wasn't that tech savvy, and I saw my patients on the phone, not on Zoom, because I didn't have a good connection. And they told me later, and I was very skeptical, that they enjoyed the phone conversation. They said you were paying more attention than in person because you had to listen. And it was very interesting that just like radio is a very intimate medium, you can pick up a lot through the voice. And the sessions actually became very meaningful. But these were with people that I had met. So again, it was an opportunity to take something that may have been difficult for people. And quite rightly, we tend to forget, as we live in our own bubbles, about the people that we don't see in therapy because they're introverts or they're shy or they don't want to come on campus or things aren't convenient or they don't have access. Now we have a more global reach, as it were. But the question is, how do you then take that optimism that can be learned, and at what point do you inject it? Where I'm going with this is that many of us are out there, not so much preaching, but it's through the whole wellness community, mindful meditation, breathing, get out with nature, do kind things. They're not platitudes, but they sometimes work for people that can do that. I think of, interpersonal therapy with behavioral activation, where you can't think your way to acting better. Sometimes it's the Nike expression, just do it. Just start to do something, no matter how you feel, that little step. Is that what you're getting at in terms of a mechanism of how to get a patient to start actually doing something to give them the positive reinforcement that allows them to then do the next thing, and then it becomes a positive feedback loop? Can you kind of maybe give us even a case study of where you've taken a patient from that dark zone to the more positive fulfillment that we're seeking?
Extremely, again, a very important aspect in our work. And there are 2 points that I want to mention. And I will pick up on your very valid, because I find them empty platitude. Go for a walk, connect with people. I'm actually currently doing a study with my research assistants where they're analyzing and coding the tips, strategies given in 1, 2, 3-minute segments on media about resilience and about dealing with COVID. Let's divorce from the idea of positive or negative. Anything that you will do, we will become habituated to it. So if you think that you have learned a couple of tricks and you can dispense them in the first session and second session, by third session, our clients are going to come. They're going to be very smart. Doc, I wrote the gratitude journal for 3 weeks, and now I'm finding doing the same thing. It's not working. So I don't believe, they won't say that, but they actually say they don't believe in that. And that actually could do more harm, or there's a premature treatment dropout, which is a big problem in our work. So I would say that the crux is individualized and dynamic interventions. Dynamic interventions, because when the client begins, again, you don't want to thirst positivity and positive. You want to listen to their narrative of distress, because you want to build a bridge of empathy. If that bridge is not built, no matter whatever you do, you can't do the work. Then you can start really slowly and gently sow some seeds of strengths and abilities. But every seed and every plant need different care at the different time of the day, different time of the season. So I'll give you an example. I was working with a client. They did the gratitude, basically the exercise for our listeners. At the end of the day, think of 3 genuine positive, no matter big or small. Think about them and write a reflection, what made them happen. Client came back and we gave them a worksheet. It worked well. Second week, fine. Third week, I'm finding the same things and I'm repeating the same thing. So it's not working. And then you bring in the more sophisticated, okay, let's do strength assessment. And one of the strengths this client had was zest. And the client has issues with sort of a borderline manic depressive kind of symptoms. And they said zest. So we said, okay, now because you want to incorporate also movement, because COVID has been so difficult for the physical activity. So we discussed, and they had purchased a bike. So we discussed that we'd do the gratitude journal, but let's do it by taking pictures. We discussed they deliberately changed their route to a more scenic route and start taking pictures. This became very meaningful to them for a couple of weeks. And then we started working, okay, how to do the interpersonal gratitude. So rather than writing gratitude only about yourself, is any positive interaction that you had with friends or family or loved ones, and then the focus. So you keep on shifting because the joy is in the variety, the spice of these interventions. Any cognitive, any behavioral, any positive intervention is the variety, but also the fitness with the person is very, very, very important. You need to know the specific situations. You need to individualize it. You also need to break it down very concretely what clients are supposed to do. And you also need to safeguard barriers in the moment and barriers that may come or habituation that may come.
And I think what you're talking about is really the difference between what well-meaning people are doing and what trained professional therapists and psychologists are doing, which is really understanding, taking what we would call platitudes. Listen, we live in a society, North American, Western society, where it's all about positivity, and particularly in North America, it's all about just feel better, do better, be happy, and people aren't feeling happy. And the challenge, even with the gratitude, is there's no attention being paid. I saw on a LinkedIn feed that someone who I knew very, very slightly had commented in her feed about some people in her life over the years that had been mentors. There was associations to an institute that I was part of, and she really appreciated the time that she'd spent there. And I was thinking how little I know about people, what impact we have on others. And I'm speaking for all of us, that you don't know what a difference you make when you are doing a kindness or you've helped someone, and later on it makes a difference. Unfortunately, the people we want to have an impact on typically aren't interested. But I want to shift gears for a minute. As we're seeing in Canada now, which is very interesting in terms of social distress, as we tend to have in our own narrative, I won't call it so much the myth, but the idea that we're a kinder, gentler nation. We're not actually seeing that here. We're seeing a lot of unresolved anger and unresolved issues that have not been dealt with properly. We're a very rich nation. We're a very lucky nation. We're very lucky people. And yet what we're dealing with, I think, living in a postmodern secular society, but I'm hearing the kind of rumblings of a kind of secular, I won't call it Christianity, but a kind of religious fervor, whether it's through environmentalism or climate change or a desire for a better world. And I'm not saying that we should become religious or organized religion is an answer, but clearly I'm seeing young people in particular, but also in all generations, finding meaning and finding purpose through doing those things that were taught through the centuries from the ancient Greeks onward, around finding meaning, finding belief in yourself. But what's challenging people is they don't know what to believe, because they're being inundated with a consumerist culture and they're being inundated with values that don't cohere. And so in closing, I'm looking to you for wisdom. I'm putting you on the same pedestal as Aristotle and Plato. But as we look at our different character strengths and our values, can you give us the 3 or 4 that we really need to be focusing on that can give us a kind of GPS to proper, not moral in terms of moralistic, but a proper path for us to start to get us out of this morass that we're in as we look forward to a spring and a great summer?
It's a very hard task, but what can really foster your daily dose of well-being is a couple of things. One is every day is an opportunity for a new start. So a lot of my clients, they come and they say procrastinate because, Dr. Rashid, I just couldn't do this assignment. I couldn't do this exam, because they are looking at the finish thing. So I would suggest, rather than finish, let's start. Every day is a start. Every hour is a start. There will always be setbacks, disruptions, mental disruptions, external disruptions. And when you focus on start, your attention shifts from the outcome, because we are becoming very outcome-based society. Secondly, we have also studies have shown that when you do, if not daily basis, but on a regular basis, something for others without being asked. Research has robustly shown, is actually Liz Dunn's study from UBC has shown it tremendously well. She gave $10 to spend on themselves and $10 to spend on others. The effects were those who spend on others were far more happier. And last but not least, humor. And humor doesn't mean that you need to be playful and you need to be a stand-up comedian. Smile. Because when you smile, the other person smiles. Rigorous studies show that a positive effect transferred to you. If I'm going to smile at you, you're going to smile at one other person, and that person is going to make the other person happy. So it's 3 degrees of happiness. Classic studies published in 2008. So find ways to smile at small little things, because what that will do is that again comes from absolutely wonderful research base of Barbara Fredrickson that will open up your channels. Positive emotions open up your cognitive and attentional channel, and they shift kind of a reset button. So whenever during the day you are stuck in something, find a way to smile, find a way to do something positive, because positive emotions will reset your button. There are some times when you really need to dig deep. If this is a loss, if this is something that you need to contemplate, but generally, all things equal, generally, smiling mixed with playfulness can make you brighten up your day. And I've recently published a paper that despite having clinical conditions, what strengths which predict treatment outcome over and above symptoms. And some of them were flagged as gratitude. Gratitude is a medicine with no side effect. I didn't say this. Robert Heyman said that. He's a wonderful researcher in that. Also, our ability to connect, love. We have so many ways to be divisive. So love, gratitude, zest. If Dr. Muskat, if I could do some intervention with my young people, that is sleep. We are massively having a sleep deficit society, which is not going to be helpful. Sleep is related to self-regulation. And when you have a good night's sleep, Gallup's study of more than 200 countries, they asked people what makes a good day. Among 3 things, I was able to do things that I wanted to do, and I was able to connect, and I had a good night's sleep. So love, zest, hope and optimism I already talked about. And last but not least, humility. I think we are becoming a very, very spectator society. Let's reflect. What is our purpose and meaning? We can't do that if we are not humble and know our limitations. If COVID has taught us nothing, it has taught us, sometimes in a harsh way, how little control we have over our own life. But the control that we have, why we don't exercise in positive paths.
Those are excellent, excellent points to close the show on. And I think that I'm so delighted to have you speak to us virtually. And it only makes me think how much more I want to see you in person. And I urge our listeners to think with zest, gratitude, humility, and love. And for the rest of it, I'm going to sleep on it. I'm again grateful, Dr. Rashid and Dr. Jack Muskat. Stay well, everybody.
That was Dr. Tayyab Rashid in conversation with Dr. Jack Muskat, the Clinical Director of Psychology here at Medcan.
We'll post highlights and links at eatmovethinkpodcast.com.
If you'd like to say hello, send us a tip or a suggestion, just email us at info@eatmovethinkpodcast.com.
Eat Move Think is produced by Ghost Bureau. Senior producer is Russell Gregg. Jasmine Ratch is managing producer.
Social media and strategy support is from Chantel Gertain and Andrew Imex. Executive producer is Christopher Shulgin.
Remember to rate and subscribe to Eat Move Think on your favorite podcast platform. Follow our host, Sean Francis, on Twitter and Instagram at Sean C. Francis. That's Sean with a U, and Medcan at Medcan Live Well.
If you'd like to talk about opportunities to support your own mental health, contact a member of Medcan's mental wellbeing team at mentalwellbeing@medcan.com. We'll be back soon with a new episode examining the latest in health and wellness.